Hi, everyone. Welcome to Democratic Caucus. Lori Houghton, I represent Essex Junction. It's beautiful outside, so we are going to keep this short and maybe people can go for a walk or they're doing lunch. And we're going to have Doug Bishop come up. I have no announcements for the morning, and Doug's going to come up and talk about a bill coming out of Human Services, an act relating to the Medicaid payment model for residential substance use disorder treatment services. Come on up, please.
Good morning, everyone. Doug Bishop from Colchester. And this bill has grown a little bit, first in the Senate and over here in the House. So it's really a bill in three parts.
Hold on, we should have you use the microphone.
Okay, so this bill is now a bill in three parts, if you will, related to the Agency of Human Services and the Human Services Board. The first part is for residential treatment coverage for Medicaid patients, and it clarifies Medicaid coverage for both high and low intensity residential treatment programs for people who are dealing with co-occurring substance use disorder and mental health conditions. Coverage must extend through the length of stay as prescribed by a healthcare provider. Historically, there seems to be some confusion about whether that is simply 14 days that is authorized. This bill makes clear that it's for the length of stay as medically prescribed by a healthcare provider. Finally, for this first section, AHS is going to review the Medicaid payment model for these services and report back to us in December, so we can see what changes, if any, need to be made at the start of the next legislative session. The second part of the bill relates to what's referred to in statute as public inebriates. So a few years back, I think maybe it was in 2019, there was a provision, statute that became law that would prohibit the use of the Department of Corrections to house overnight inebriates, public inebriates. That implementation has been delayed, mostly due to the lack of public inebriate programs. So in the community, the opportunity to house someone for up to 24 hours rather than housing them at the DOC facility. Unfortunately, the availability of these public inebriate programs, or PIPs, has not been there. In fact, the one in Chittenden County is no longer available. So due to a lack of availability of PIP beds, as well as in some instances, the appropriateness of perhaps housing someone at DOC for the night, the prohibition of using DOC has been pushed out. And as part of S36, the Senate included a complete repeal of that prohibition of using DOC. We actually heard from quite a few witnesses on this part of the bill, including folks from DOC, law enforcement, nurses, public inebriate program providers, and to a degree, all of them suggested we actually keep Department of Corrections facilities as an option if needed. There was fairly passionate testimony by nurses that lodging people overnight in emergency departments as a default was potentially dangerous, certainly distracting to their work, and overall just created additional challenges to already challenging work. I will also share that Agency of Human Services does have a 2-year plan to help build out and strengthen the public inebriate programs. Funding is included in the governor's ask for FY26 and is currently in the big bill. And the hope is to create more community options through public inebriate programs. Let's see, the committee is looking, so we're looking at that question, whether in fact there should be a full repeal or simply a delay in the whether DOC can or should be used to house public inebriates. The final part of the bill refers to the appeals process for the Human Services Board. So someone who's looking to appeal an eligibility or benefits decision of the Agency of Human Services has an option to ultimately appeal it to the Human Services Board. And in the vast majority of instances, those appellants are coming without an attorney or pro se. But always on the other side for the department or the agency, I should say, or could be an attorney from one of the various departments within the agency, or it might be an assistant attorney general. So there's a power imbalance. There's a lack of familiarity by the appellants. They can feel intimidated in the process, not understand appropriate means of introducing evidence or what testimony is permissible. So we have taken testimony on that and asked the agency to come back to us in December and answering some questions in a report of how we can create a more user-friendly option or user-friendly approach for per se appellants as they come and appeal a decision of the Agency of Human Services. So that is our S-36 bill in 3 parts.
Great. When is it set to come to the floor?
We may have it out of committee, it's tomorrow, so the earliest it could come to the floor on Friday, and if not, then Tuesday.
Any questions?
Yes.
We now have 2 mics.
I'll be closer to me.
It's people.
Thank you. I'm Robin Shy from House Appropriations Committee. You could probably guess where this is going. The first part, you talked about the Medicare and possibly being able to go beyond Medicaid, going beyond the 14 days. I heard that from our Turning Point and other places that would be a really good thing. So I think that's great. I'm just wondering what that means in terms of money, potential appropriations, and does this come under the Medicaid waiver, the 1115 waiver? How are we going to pay for it? Thanks.
With respect to whether it comes under the waiver, I'm looking for a nod. Yes, a nod from my chair. It does come under the waiver. We didn't take specific testimony as to additional costs of the state's portion of that.
We were assured by the state that in fact that this is clarifying what the current process already is in terms of the medical necessity of the treatment. And part of the bill that Representative Bishop spoke to in terms of how it's reimbursed on a per session basis, or which the sessions last, guess what, 14 days. And so they're looking at changing up how it's reimbursed so that it doesn't appear and that people have the greater flexibility of being there for the length of time that is needed. So I think those two things will work in concert, but they said they could do this within their existing funding.
Other questions? Right, great. Thank you, everyone. Have a great Tuesday and do hope you can get outside and enjoy the sunset.